Hey everybody, Luke Gordon again, back with another video about total knee replacement surgery. And today's topic is if you need to lose weight before total knee replacement surgery. I want to give you some tips and tricks that I've learned just from working with a lot of clients who had to lose weight before their total knee surgery. So I just want to outline like my favorite tips and tricks, the ones I think are the most bang for your buck, that I think if you do them on a consistent basis, you'll get the most return and you'll experience the most rapid weight loss. So some background to this story is that a lot of people are being told nowadays by their surgeon that in order for them to basically like qualify for a total knee replacement, they have to get their body weight below a certain level. So they're usually tying this to your body weight or your body mass index, which basically takes your height and your weight, and it's a ratio, and they want you, like, let's say they want you below 30. So a lot of our clients are coming to PT now and saying, well, the surgeon won't do the surgery unless I get down to this level of weight. I need to lose 30 pounds, I need to lose 40 pounds, whatever it may be. And then, of course, the real struggle for people is they say, well, how am I supposed to lose weight when my knee hurts so much? Exercise isn't that comfortable. Walking isn't that comfortable. So what am I supposed to do? So that's what I want to address in today's video. Again, I'm going to give you my favorite things that you can do to lose weight fairly quickly but before surgery. So let's just go through. Again, keep in mind, these are my opinions. I've seen them work for a lot of people. You may disagree with me on how to lose weight. That's fine. But I think if you're willing to give it a shot, these tips can really help you. So if you want to lose weight, to me, the most basic, simplest, most effective thing you can do right now is simply get rid of a lot of the crappy foods that are in your diet. Now, when I say crappy foods, let's pick on some obvious ones first. If you're drinking soda all day, sugary drinks, that's an obvious one. Excess sugar in your bloodstream is going to convert to fat. And that's how a lot of people are gaining weight or keeping on weight. So if you got some of those easy ones, high sugary drinks, you're drinking Coke every day, you're drinking a glass of orange juice every day. I know it's juice and it's got some healthy qualities, but it's sugar. So sugar, 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 get rid of the sugar, any of the processed sugar, any of the refined sugars, just cut those out because, again, they are contributing to your weight on a regular basis. So that's the first thing I would do. And then along the same guidelines with sugar, when I think of sugar and what I think you should think of sugar is a lot of your simple carbs are simply sugar as well. So let's pick on a common thing like toast or bread or your bagel or your pasta. Now, again, you may not want to hear all these things, but if you're trying to lose weight and you're very motivated, maybe it's time to consider these things. So having a couple pieces of toast, look at how many carbs are in there. The excess, all those carbs are going to rapidly convert to glucose in your bloodstream. Excess glucose is going to trigger your pancreas to release, what's the chemical we're looking for? Diabetics have a problem. I'll come back to that. You're going to release those chemicals and it's going to store as fat. I should know this. I have 2 type 1 diabetics in the family. But anyhow, so you want to cut those foods out because, again, you're converting glucose to fat. And so bread, pasta, rice, noodles, all those things. And what I would do is say, you're not trying to starve, you're not trying to go hungry. Replace those foods, those calories, with better quality fats and proteins. That right there, I think, is the best way to lose 30 to 40 pounds in a short period of time. Rapidly lower the amount of sugar and carbohydrates in your diet and replace them with higher quality foods, vegetables, high quality proteins, high quality fats. Personally, I don't think you should be afraid of fat, especially when it comes to weight loss. If you've tried to lose weight before, you may already know cutting fat doesn't tend to work. Cutting carbs does tend to work. So look around online. If you're looking for recipes or more guidance, I would say look up keto diet, look up the paleo diet, because a lot of them are just super low carb, and they're focusing you on lots of veggies, lots of proteins, lots of fat. So there we go. Still not quite coming back to that word, but anyhow, I hope that helps you out. It can be done, and keep in mind too, the same diet doesn't work for everybody, so you may have to do some problem solving. You may want to work with a dietitian or something like that, but I think that overall is the big overarching theme of losing weight before knee surgery. Cut those carbs, cut those sugars, get rid of some of that junky food. Now, one last thing I want to say before I go is that I just made a video, which I'll pop up above here, about can you avoid knee surgery? So, and what I talked about in that video, and again, I'll pop it up below me here, is that sometimes when you take out these foods, especially the sugars, and if you take out like some of the gluten and some of the more aggravating things that are aggravating to a lot of people across the world and across our country, sometimes you actually are going to experience some pain relief. So it's like an added bonus. So what I would do if you're focused on losing weight is try an approach like the one I mentioned in today's video, but then also just keep an eye out for the fact that you might feel a little better with eliminating some of these foods, especially the sugars and the grains and things like that. So keep that in mind, and then also keep in mind that the reason you may be feeling better is not necessarily because you lost 5 pounds or 10 pounds or 20 pounds, although that certainly does take some pressure off your knee. The reason you might be feeling so much better though is that you took out some inflammatory foods. So just keep that in mind. I hope either way that this video helps you lose weight, and I would love to hear from you. So please leave me a comment below. If you haven't already, I would appreciate you liking the video and subscribing to my channel so you can see all my future videos. That's it for now. Thank you for watching, and best of luck with your knee.